Hi, everybody. Welcome to the podcast, Redesigning Normal. I'm your host, Andrew Southern, and today I'm joined by Dr. Melissa Thompson, who is the VP of Medical Operations at the Arizona Humane Society. Doctor, it's nice to have you on the podcast.
Thank you. I'm a pleasure to be here.
Awesome. So, can you tell us a little bit about the Arizona Humane Society, firstly, and then secondly, how you came to work there?
Sure. So the Arizona Humane Society is a nonprofit organization. We are fully funded by donations, and we focus on taking care of our county's sick and injured animals. So there is a county animal shelter, and they take care of the stray animals and do your basic animal care processes. But we focus on the sick and injured. So we have an animal medical technician team that goes out and actually rescues animals. They pick up animals that may have been hit by a car, attacked by other animals. We do investigations for cruelty. So that's our EAMTs. Those animals then come into our Second Chance Animal Trauma Hospital, which is the second largest animal trauma hospital of its kind in the Southwest. In that facility, we see about 12,000 animals per year. And again, these are sick, injured, stray animals. We do not see owned animals from the public in this space. So those are the animals that we focus on. The Humane Society we have so many programs in under one roof. It's really difficult to try to sum it all up in a very short period of time. But we also treat a lot of what's considered untreatable conditions that other shelters might see. So we have a parvo ward. We have a neonatal bottle baby kitten nursery. We've got a kitten
Hmm.
nursery. We've got a maternity ward for pregnant mama dogs that are expecting their babies. So we really try to push the envelope on what types of animals that we can treat. And it is the most rewarding experience. I would love if anytime you're in Arizona, you need to come by and we can give you a tour.
I will, and I will be there. So the ultimate goal, I would imagine, and I'm just going to get into it, with all these animals is to help them stay healthy and then find them a forever home. That's
Absolutely, yes. So
okay.
our goal is to get these animals healthy, take care of whatever issues they come in with, whether it's an illness, whether it's an injury. We even do orthopedic procedures in our facility, and to find them their forever home. And that's on our shelter side. We also have public facing clinics as well. So we do offer
Okay.
low cost veterinary care. So we have a low cost spay neuter clinic as well as a low cost general veterinary clinic serving the people in our community. And we also have a mobile unit that allows us to go out and provide different services to different areas as well.
And I'm imagining that because of your role as a doctor of veterinary practice, that you are on the health side of this spectrum as opposed to the like adoption foster side of the organization. Is that correct?
Correct. Yes. So my focus is the medical, all things medical. So that's
All
both the
things medical.
shelter and the public side of it. And actually, foster kind of falls into that as well because about 99.5% of the animals that go into foster care are because of medical reasons. So they go into a home to recover from whatever medical issue that they have instead of staying in the
Hmm.
shelter to recover. So
Okay.
I oversee the foster piece of it as well.
This, I fostered a dog where I live during COVID, and of course she became our forever dog. Right? Is that
Yes.
like an
Yes.
isn't that like the Trojan horse? It's like, hey, will you foster this dog that needs recovery? And then they like that's their forever home.
Absolutely, absolutely. I am a card carrying member of the foster failure club myself.
Foster failure.
Yes, I have currently I have 8 foster failures. I have foster failed a lot more throughout my lifetime as a veterinarian, but yes, I 100% know that drill.
That is so that's like that's the Trojan horse for folks that are like in the adoption like services world. It's like,
Right.
oh, just foster the dog, like it's no problem. Just like take it for like a month. He
Yeah.
never comes back.
Right. Yep. Yep.
We have a foster failure situation on our house, and you know what? I'm happy to have her. And she was a stray, and we were able to kind of fix her up and get her healthy. She had rash and all this stuff. So that was really a great thing. And in return, she like looks after our family. That's the deal.
Yeah, perfect. Perfect. She gives you
Really
unconditional
nice.
love in return.
Yeah, exactly. So okay, so how did you get there to the Humane Society?
So I think if you ask veterinarians, pretty much all of us will say, since we were kids, we wanted to be veterinarians. So that was the same case for me. Like when I was 8, I
Okay.
decided I was going to be a vet, and here we are. I've always had an interest in shelter medicine. I started off in general practice, just seeing, dogs and cats, and then started dabbling on the side, if you will, doing some work with a local rescue. And then I actually started as a volunteer vet at the Arizona Humane Society first.
Okay.
So I went in and did some volunteer shifts, and then I got hooked, and then I started full time in the Second Chance Animal Trauma Hospital, and was in there for, goodness gracious, time goes by so fast, about 7 years, and then got promoted to the lead vet position, and then from there got moved on up to the vice president of medical operations.
Wow. Wow, that's amazing. And where are the dogs coming, or dog, I'm not saying dog, like where are the animals coming from? Are they're being rounded up by some authority and bringing them to you because they need help?
Well, so again, we get a large portion of our animals come in through our EAMT, our field team. So those are
Hmm.
folks, our specially trained team that goes out and does rescues. So people, good Samaritans may call and say, hey, I saw this kitten in a storm drain. I saw this cat up a tree. We literally had a call of a dog on a roof. Like, how does that happen? So they go out
Right,
and they
right.
pick up, yeah, they pick up the calls that good Samaritans call in, or perhaps we assist a police, the police department, if they're going in and they're have someone that they are apprehending for whatever reason, and there's pets there, we'll go and we'll take the pets. We also do active investigations, so hoarding cases, cruelty cases. So we get a
Okay,
large amount of our animals that way, but we
okay,
also take in owner surrenders. So if somebody's in a position where, they need to relinquish their pet, we do take owner surrenders as well.
okay. So it's coming from all kinds of places.
Absolutely.
Was it, this is maybe a little bit off of what you're doing, but like I had read an article that during this COVID time that a lot of people like me thought, hey, this is a good time to have a companion around, and ended up there was like a big wave of people either fostering or adopting animals. Was that the case in Arizona as well?
Absolutely. We say that that was kind of the silver lining of COVID. We saw our adoption numbers increase greatly. We saw our foster numbers increase greatly, and for the temporary period of time, we actually saw our admissions decrease, which is a
Okay.
great thing, right? But then when you have people who are looking for animals, what do you do? And so we actually were able to. We have a program called Project Reach Out, where we will go to other shelters that we are sister shelters with, if you will, and we start locally and try to help out local shelters. If they have too many pets, we'll bring pets from those shelters, whether they're healthy or have medical issues, we'll bring them in. And then as we were finding that the local shelters were pretty well in the same predicament that we were in, and not having, we
Hmm.
were able to go out farther. So we went out and went to the reservations, asked if they needed help. We did some out of state transfers. And so, we were
Hmm.
first making sure that our community was being served, and making sure that those animals got the care that they needed. But once we realized that we were, making some headway there, it was time to reach out and find some from other areas. So we were able to bring in those animals to then fulfill what people were looking for, trying to
Okay.
find more pets to adopt.
Has that uh, sort of renormalized back to sort of more normal levels in terms of like, for lack of a better term, like sort of like stock in the foster system, like because there's an endless supply of these animals, I'm sure,
Absolutely.
unfortunately,
Yeah.
and so there's this wave of people that are happily adopting, and then there's more animals coming, right? So
Right. Yeah.
is that
So
has that wave ended?
So we will, as Arizona has been fortunate in getting a good number of people vaccinated, and so our world is kind of going back to normal here in the state, and then which equals at Arizona Humane. So people are going back to work, so we have noticed a little bit of a down trickle of adoptions, because people are getting back to their normal routines and not looking to add a pet to their home right now.
Hmm. Hmm.
And with that, we also found that our foster base, while we still have a great number of volunteers who do foster, again, people are going back to work, so they might not be able to take that kitten that needs round the clock care or things like that.
Sure.
So we have noticed a decrease in the ability to get those animals out in a very timely fashion. Doesn't mean that we're
Okay.
still not getting them out to homes. It's just taking a little bit longer than it was during COVID.
Got it. Okay. I have a really random question for you because you were in private practice for a while, and now of course you're in the public sector. Um, is there like a percentage of people? Obviously, some people like dogs, some people like cats, some people like both, some people like birds. Is it like dogs are the heavy winner or cats like it, or is it 50-50? Like what do you see anecdotally from people who have animals?
So I would tend to say that it's more dog driven than cat driven.
Okay.
Um, in private practice, we would see, probably 75% of our clientele were dogs and,
Okay.
25% cats. And in the shelter, we actually see more cats come into the shelter. They seem to be relinquished more often, or they're found as strays, right? Because cats tend to
Okay.
roam, and so we see fewer dogs than cats. Not a huge discrepancy. It's probably like 60-40 ish type
Okay.
cats than dogs. But as far as adoptions go, we adopt out a lot more dogs. Like people are looking for dogs more than cats.
Okay. So there's sort of two data points there. And then are you in touch with like other states? Like, because I can imagine like maybe like more urban areas, people have cats because like
Right.
they have like apartments or something.
Right. And yeah, that's a perfect example. We're still very, we're not as highly populated as you are there in New York. And,
Right.
so yes, you're going to find folks that are going to be more apartment dwelling to have cats. And there's also the difficulties of trying to find housing that will allow dogs too. I mean, animals in
Sure.
general, but usually dogs, people think of dogs as being a little bit more destructive, which is not always
Sure.
the case. But, it is a little bit more difficult to have a dog in an apartment versus a house setting where they have a yard and it's easier to get them some exercise.
Got it. I know for our audience that this podcast is about redesigning normal, and we're going to get into it. But I have these other questions for you now that I've got you on the on the line. What about this like this idea of like cutting the animals like nails off? Is that a thing that we shouldn't be doing because
Um,
they're animals?
yeah, that is a loaded question, and you can definitely cause some fireworks with that one. You throw that one into a room. Um, yeah,
I
that
have no
that's what.
opinion. I don't know.
Yeah, so it is a tough spot, and it's something that has been done for years, and trying to make cats more a better pet, right? Because people don't want their furniture ruined or what have you. What they're not paying attention to is the fact that that's a normal behavior for a cat. That's just something that they do, and that when it's not just trimming the nails, when that procedure is done, it is literally removing the very end of the bone of the toe. So it's a very painful procedure. It's some folks would call it cruel. So
Mhm.
it's an opportunity for us to learn and appreciate the cat's behavior and trying to find things that could possibly give it other resources to work on. So kitty scratcher
Okay.
toys, teaching them how to trim the nails as opposed to declawing them, because
Okay.
there can be lifelong effects from declawing a cat. So it's less than ideal for sure.
So like if a cat has like really like like sharp like whatever, you could trim that off without cutting the
Yes,
whole like thing off.
absolutely. Just like we trim our own
Okay.
fingernails, right? Yep. Or if you had a
Okay.
dog, you get their toenails trimmed. So you can trim your cat's nails. I trim my cat's nails. I convinced I have a family member who had cats and has always had them declawed, and I convinced her to not declaw her cats after I was a vet, and she's like, okay, so every 6 weeks I need to go over to her house and trim the cat's nails. That was part of the deal, but at least we didn't go through the surgery, right?
You have one of these jobs where it's like if you go over to someone's house and like like more than half the people have a dog or a cat or whatever, and they're like, "Hey, thanks for coming over. Listen, I got a question about Max's
Yes.
like fur."
Yep. Hey, can you take a look at this? Or it's the joke is how many pictures of things that I get on my phone. I'll get a random
Right.
text from somebody that I hadn't seen in I don't know a year, and you get this random picture. And they're like, "Hey, what do you think of this?" I'm like, oh, "Seriously, guys?"
My dad's a doctor in New Jersey, and it's like I do the same thing to him, and I'll like send
Yeah,
him like a picture of like my kid's like rash, and be like, "What
yeah,
is it?" He's like, "I don't know. I'm not in
right,
front of them."
right,
Um,
yep,
that's so funny. So it happens to you too. As a technology consultant, I'll often get something. It'll be like, "Oh, it's so good to see you. I got a problem with my phone. Like, how do
mm-hmm.
how do you get to the other screen?" Um, all right. Well, let me get back on topic for a minute. So March, early March 2020. Okay, let's go in a time machine backwards. Was there a time, maybe in February, maybe in March, where you realized that this thing that you were hearing about coming out of China, that this virus was going to affect you and the Humane Society directly? Do you remember any of that time?
Oh my goodness. How can in like you want to say how can you forget, but at the same time it was a whirlwind, right? I
Hmm.
still remember the day that we ended up almost pulling our stuff out and just going home and working from home kind of thing. So I do remember that, and the intensity that was around that period of time was like nothing any of us have ever experienced.
Wow. Was there like a day where someone had to make the call and be like, okay, we're closed. You can't really close because there's animals there.
Right, right. So yeah, so we're in an interesting predicament. So we serve the community, and you can't
Hmm.
necessarily just shut that down. And so it was a balance of trying to determine what things we had to keep going and what things we could kind of either shut down or have people work from home. I mean, up to that
Hmm.
point, no one worked from home. That wasn't part of what AHS did. And so we actually, it was middle of March, it was March 13th. We had to shut down our spay neuter clinics. There was a mandate that was passed out by our governor that said that no non-essential surgeries. So spay neuter is considered non-essential. And in the shelter world,
Okay.
we think of it as very essential, but
That, like it's like the key, right? Right.
right, right. But it's not a life or death type of procedure, right? And it was more important
Hmm.
to make sure that we were saving the supplies for our human counterparts, the doctors, the nurses that were on the front lines, that we weren't using those PPE articles in doing the non-essential surgeries
I
and
see.
saving them for them. So we did shut down our spay neuter clinics. So that was a big, oh my gosh, we haven't had to do this before, and then um, along with that, it was okay, we have X amount of staff, we have to take care of these animals. And while I talk about how much work our second chance hospital does, or our other departments, our facility is very, very small. So our big
Okay.
struggle was, how do we keep people safe but still perform our functions? So we had to really stop and think, how can we do this and limit the
Hmm.
amount of people that are in one small space, still take care of the animals? So we had adoptions in 4 different locations. We then closed 2 of our adoption offsite locations, and then our main campus location, and then moved it all to our South Mountain location, which is our largest facility, but it is an adoption facility. So we felt that
Hmm.
we could then have teams on rotated schedules. The area was big enough to space out. We didn't have to worry about being on top of each other. And that enabled us to reduce the number of people that were at our main campus, which is where all of our intakes happen. That's where the trauma
Okay.
hospital is. And so we wanted to make sure that we were keeping everybody who was working on the animals, the medical side of the team, and our admissions team, those folks that were front line, we needed to try and keep them safe. So we reduced the number of people coming into that facility, whether it be workers or the public. We then put everybody on we call them A, B, C, D schedules. So nobody overlapped. So we had an A schedule that worked, three on one week, 4 on the other. So it was like Monday through or Sunday through Tuesday, and then Sunday through Wednesday, every other week. And then they had the opposite schedule for B schedule. So again, nobody
Right.
overlapped. And then C and D, we actually morphed our trauma hospital to a 24-hour operation, because we had closed down our public facing clinic, our spay neuter clinics. We still wanted to keep our staff employed, right? We didn't want to have to lay anybody
Hmm.
off. We didn't know what was going to happen, long term. So that was our answer. We were still able to serve the animals that were coming in, keep everybody employed, and keep everybody safe by then going to that 24 hours. So again, we had between the day shift and the night shift, we had a half-hour gap of time where nobody was there. So at the end of that day shift, everybody cleaned thoroughly. The hospital was
Right.
void of people for 30 minutes, and then the new shift came on. And so we did that throughout the
Sure.
summer.
Did the intakes increase or decrease during that time? Like, or did
So
you have the same amount of animals coming?
we actually saw a decrease over the past past year, which we were so thankful of, because at the time we didn't know
Hmm.
what was going to happen. There was the worry, watching what was happening in New York, right? That was very scary to see how many people were falling ill and passing away. And then the concern was, what's going to happen to pets from those people?
Right.
Should somebody be hospitalized? Should somebody be, pass
Mm.
away? And so we were braced for it. We were ready for, impact, if you will. And thankfully we didn't have it. We did have plans in place, and we had to work. We did have some cases, and the other concern is that pets, although rare, can contract COVID. And the concern was, okay, are our staff going to be at risk if we do take in animals that were in with people that had known COVID? We bring them into our facility, then our staff is handling them. So we had quarantine policies in place, making sure that our staff were handling them correctly. We had different PPE to wear in the event that there was a
Hmm.
pet that had been exposed to COVID. And same thing with our field teams. So our EAMTs, they were the folks that were actually going to these homes and pulling these animals
Right.
out should somebody be, taken off in the ambulance or pass away. And so, they had the full um, Tyvek suit and
Wow.
stuff going on, because
Yeah.
again, at that point, we know so much more now, even though there's still a lot to learn. We
Mhm.
know so much more now than we did a year ago. And, nobody
Sure.
really knew what we were dealing with.
Yeah. I mean, anecdotally have sort of noticed that like a lot of the sort of touch point stuff, the sanitizers and all that, maybe sort of like falling away because some of the science I think is saying that like the transmission via like touch is maybe not as high as they thought, whereas like aerosol is quite high. And so
Right.
that's slowly been changing. It's not the case everywhere, and certainly there's a case to be made for like cleaning and sanitizing spaces anyway, right?
Hmm.
But
Right.
but you just that idea of like everywhere you go, you have to pump, stuff into your hands. Maybe not as frantically followed, at least not where I am right now. I don't know how it is where you are.
Well, yeah, and I would agree. I mean, some people it's very ingrained, but I think that, to your point, it's kind of wound down a bit. But as you know, at the
Yeah.
beginning, you couldn't even find hand sanitizer, right? Like it
Yeah.
was
Yeah.
worth its weight in gold. And so again, a lot of these were put together just based on whatever the CDC was saying at that time, because that's all we had to go off of, right? Um,
Sure. Yeah. So have you seen animals that had COVID?
so I can't say that we have had any that have had respiratory issues that we've tested and anything came back on. Um, I don't want to have, I guess, spoil alert. We did work in collaboration with a local university in testing random animals that came through our facility.
Hmm.
And we did get some data showing that there were some animals that came through that had COVID that we did not know. They weren't showing any clinical signs. This was just a randomized study, and
Sure.
that's
Right.
yet to be published to give the percentages. But again, we didn't have the results of those tests until well after pets had moved on, and then that data needs to be scrutinized too. Is it were they are they had did they actually have it? Did they have it before?
Hmm.
Was it So there was definitely no clinical signs on that whatsoever.
It's interesting.
Yeah.
I'll read it when it comes out. So back to your facility. So were you doing like temperature checks for all the folks that were working there, and like what were you doing to help keep people that were coming to work or coming to the facility safe?
Yeah, so for example, like I mentioned previously, we did the ABCD shifts, so that was a big
Right.
part, just trying to do the social distancing. We mandated mask wearing before it was something that our local government actually wanted us to do. We wear masks a lot in the hospital anyway, so it just turned into common practice. And we were really fortunate too. We are a nonprofit, so it's not like we can afford to go out and buy all kinds of stuff all the time. And we had an amazing band of volunteers that came together and actually made us all masks. So we all had cloth masks that they made for us, and so it was really nice just to see the spirit of everybody coming together to try to help where they could, because we function off of not just our employees but a lot of volunteers. And because we were limiting
Okay.
the number of people coming in, we actually had our volunteers discontinue coming into our different programs, which made it difficult for our staff too, because we rely on them for a certain level of work, but again, just trying to keep people safe. And so the volunteers were just finding whatever ways they could to help out, because that was their normal, they want to be part of it. We do do temperature screens and health screens. So asking the questions, have you
Sure.
yada yada yada. We all know the drill at this point in time, right? Um,
Right.
so
No, no,
yep,
no, no, no. I
yep,
think is
yep,
what everybody
exactly,
does.
exactly. So we did the temperature screening, health screening. We, like I said, we closed off 3 of our adoption areas. We moved our all of our adoptions to one main area where we knew we could space out, and we actually went and morphed to adoptions by appointment. So up to that point in time,
Okay.
we were allowing folks to just walk through the shelter, look at whatever animals, hey, I want to
Sure.
adopt this one, and they would grab an employee. Now we did it by appointment only, so we could limit the number of people that were in there and kind of limit where they could pick out which animals they wanted to see off the list, and then we would take them out for them. And whether I mention this now or we talk about what we're going to keep, but as a side note, we found that the animals actually did much better in that type of environment when they didn't have random
Huh.
people walking up and down the aisles all the time, because they have more of a schedule. So, and it was helpful for the dogs that would get overstimulated and excited when they saw somebody.
Right.
People would then meet them. Whereas if you had walked by that dog, you might have been like, "Hey, I'm not really." He's a little excited, but once he's out of the kennel, he's
Right.
great. It was just that initial meet, right? And so some of those, like
Huh.
that first few weeks of COVID, we saw some of our longtime pets actually get adopted because they didn't see that piece of it. And it's not that we're hiding
Right.
anything. It's just like that's not a natural thing that the dog would be living in anyway, right? And so, but that sets your mind up for what you think this animal is going to behave like, but that's not necessarily the
Totally.
case.
Totally.
So it's that
That's
piece really
that's an
worked out.
amazing story.
Yeah,
Yeah, exactly. It's like, and if someone had come to you and been like, I think we should do like one-on-one appointments for, you'd be like, well, why would we do that? Like we've always done it
right,
this way.
right,
The only thing that would ever cause that kind of change would be like a pandemic
right.
where you
Yep.
had to, and then you saw this. There's actually some other interviews where these sort of unknown consequences occurred.
Mm-hmm.
Um, some of them were like someone I spoke to in education. The kids go to school, but they need to be dropped off like at the curb, as
Mm-hmm.
opposed to the parents walking them in. And the administrator that I spoke to was like, "It's way better,"
Yeah.
because every day we'd have some percentage of the parents would come in with like a problem or this or that, and now it's like nope, like the kids walk in off the curb and we get to work,
Yep.
right?
Yep.
So,
Exactly.
and you never would have had that unless you had these sort of like these things in place because of COVID. So there's like
Right.
in that discussion, it was like, we're going to continue doing that
Right.
because if you continue doing that, we found that we can start school at 8:30 as opposed to like starting at 9 after we deal with like 5 parents problems or something. So
Yeah.
some of these things, do you think that that would last, or do you think that you need to like open it back up again to sort of open adoption roaming so that you can get
Oh
through the animals?
no, we call some of these things our COVID keepers. So stuff that
Okay.
we've done, put into place during COVID, and we found that operations function much better this way. So there are things that
Okay.
we definitely put in place during the pandemic that are going to stay. We're probably going to have some hybrid models of some other stuff, but it was just a great opportunity. It gave you a license to try, right? Just like you said, like
Sure.
otherwise the world would have been looking at you and saying you're doing what? And it's like, well, you got to
Right.
make it work. And it's like, holy cow, it actually did work, and it works even better than the way it was before. So our adoptions by appointment, we went to
Huh.
curbside appointments for our foster pickups, for our foster drop offs, for our admissions appointments, for our front facing public clinic staff, those visits. So we did a lot of curbside. Um, so yeah, that's kind of the big changes that we did.
Sure.
And then work from home. That's again, that was not something that was part of our strategy at the shelter, because there's just camaraderie when you're at the shelter. But we're finding that that you can get some stuff done when you're not at the shelter. It's not always chaos if you're at home a couple days a week, so you can actually get some work done versus when you're there. It's just you're hands on in the middle of everything. So
Yeah.
it's been
Yeah.
an
Exactly.
interesting
I think
year.
I hear that too. It's like remote work, it kind of proved itself, but it's probably not like the 100% solution. It's probably like
No.
becomes like blended into,
Yes.
people's week, which is, I
Yes.
think everybody would, I would certainly would feel that. I feel that way. Like I like being with people. Certainly you need to see the animals in person,
Right.
right?
Right.
There's a lot of your work that has to be done like in person. And there's a lot of businesses and a lot of different organizations that really do need to come together. However, maybe there's like a quarter of the work you can do online. You
Right.
know, some. So I feel like we'll figure out like where that actually fits. Like where does Zoom actually like fit, in the day? And it's different for everybody. But it's funny, I think in a lot of these discussions it comes up again where it's like we want to come back together again. We want to have our culture together
Hmm.
in the
Yes.
same space, but we did learn that like some of that paperwork can be done online.
Right. Right. So, but yeah, and it does
Well,
make you appreciate your team for sure.
for sure. How big is your team again?
Oh my goodness. So we have about I believe about 270, 280 employees for the organization. And about of that, I think we have about 85 under the medical heading. So there's a couple of people.
Awesome. Well, anyone that's listening to this podcast, please consider donating to the Arizona Humane Society because it sounds like it's a great organization. I'm just going to put that plug in for you.
I appreciate it. I appreciate it. We're doing a lot of work for our
It
community.
sounds
I
like you're
mean,
doing great work.
yeah, and being able to stay open, and where everybody is so focused on our mission, and we save the most vulnerable pets, and everybody there was, our frontline staff have been amazing through all of this, and just putting their head down, and just wanting to make sure that we can't leave the animals, right? We have to take care of them. That is our role, and making sure that we help the people too. People think that it's just animals, but the human animal bond is strong, and it goes both ways. We love our pets, but our pets love us as well. And so it's been a really tough year for folks with this pandemic, and it has hit some harder than others. And making sure that we're trying to provide for the people so that they can keep their pets, because we really don't want to have animals in our shelter. That would be the best day in the
Right.
world, is to not have to have animals in a shelter. And so what can we do to try to keep people with their pets? And you know during COVID, there has been the mandates that have pushed off the moratoriums for rent, and allowing people to stay in homes so they didn't have to be evicted. But those moratoriums are coming to an end, and we are already seeing an uptick of people who are finding themselves homeless, and temporary homelessness. And so instead of them having to relinquish their pets, we put together a program. We have the Pet Housing Help AZ Task Force, and we came together with other organizations in our community to try to help people keep their pets, so
Sure.
they can go through our program, and we'll actually temporarily surrender them to us. And what that is, it's a fostering program. So they sign them over for 30, 60, 90 days to give them an opportunity to focus on what they need to get things situated. And we in turn will foster those dogs and cats, to either one of our foster heroes, or we work with some of our partners. Like I said, we may do some long-term boarding for them, so that way when the owner is back up on their feet, that pet can go back with them. I mean, it's
Hmm.
way better than trying to find them a new home, and it's a win-win for everybody. So that's our
Sure.
that's our next endeavor, if you will. One of the things that's coming out of COVID is recognizing that there's a huge human impact, and what can we do to try to help the animals and the people.
Sure. It's amazing work. I never thought about like the fact that like the perfect day for your organization is when there's like no more animals
Hmm.
in that facility, right? Like
Right.
that would be, unfortunately, you probably will never get there, right? But like that would be the ultimate goal, would be to
Yes.
not have any need for the Arizona Humane Society because, well, I'm sure it's an amalgam of a bunch of stuff. Like populations of animals are controlled via spay and neuter and not excessive breeding or whatever. Animals all have homes. I don't even know what conditions would cause that to happen, but it would be the perfect world, right?
Hmm. Absolutely. Absolutely.
Huh. So has it been during your career? Has the sort of animal levels sort of been the same? The animals that
No,
need your help?
no. Well, that's kind of a loaded question. We've kind of transformed a lot of what we do with the organization. So Dr. Hansen, our CEO, he came on board and changed a lot, and developed these great these great new initiatives that I mentioned earlier. So our parvo ward, our kitten nursery, our bottle baby nursery, community cats, things to help prevent euthanasia. These were all things that were conditions that we would euthanize prior to his coming into the
I
organization
see.
and establishing these. So back when I
Okay.
first started with the organization, we were intaking around 40,000 pets per year, which is a significant number, right? Yeah.
Sure. Yeah. Oh my God.
And
I
our
had no
county
idea.
shelter, yeah, our county shelter as well. And, but we were only adopting out maybe 17,000. So kind of do the math, right? Like,
Yep.
and so we're nowhere near that now. We're intaking around 17, 18,000. We're adopting out probably about 80% of the animals that come in,
Okay.
which is fantastic, right? And we also have to remember that we do take in the worst conditioned animals. So again, we're getting a lot of these animals that were found hit by a car, dying on the side of the road, and
Okay.
euthanasia is oftentimes in that type of situation the best thing that you can do for them. So we don't focus on our live release rate number as much. We're what we refer to as we have an ethical no kill policy. So we don't euthanize for time or space, but focus on that animal. So if the best thing for that animal, because if we have to end suffering, is euthanasia, then that is what we will do, and not worry about whether that's going to impact our number or not. So
Okay. Sure. Okay. So actually, I'm just going back to the sort of the animal discovery portion of this. Like, if the police respond to a whatever, like a call at a house, and it turns out that there's a problem, like there's a hoarding problem at that house. The police discovered it. They call the Humane Society of Arizona and say there's some animals here. That like is that when the organization gets involved? Like when there's an animal that's like at that house.
absolutely, that's one of the ways. Yes, so we have contracts with 9 of the major cities in our area,
Okay.
and so whether it's a Good Samaritan that calls, and depending on which jurisdiction, we might actually go out and investigate first, or the police. So it just
Okay.
depends on what jurisdiction. But yeah, so the police could go into a house and find that, oh my gosh, there's 200 cats, and they say, hey,
Right.
we need you guys, and we show up and we catch all the cats and figure out what to do from there. We've had large rabbit hordes. We had one last year. Gentleman was raising them for meat and sale on Craigslist, and it was over 200 rabbits that we brought into our
Mm.
facility, and just kind of make it work. We got them spayed and neutered and adopted out. Um, so
Wow.
it Yeah,
Wow.
there's never a shortage of fun things to do.
What that made me think, like, what other animals have you seen? Have you ever seen like an exotic cat that
Not
came into the Humane Society?
Well, like occasionally you'll get a bobcat kitten because people think that
Okay.
they're a kitten.
Right. Okay.
And you're like, no, 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 no. So we partner with again other organizations. So there's some wildlife groups out here that if something like that comes in to us, so we've had the bobcat kittens come in that we hand them over to them. They have the professionals, if you will. They've got the experience in dealing with
Okay.
those, and they rehabilitate
Sure.
them to read. But we've had houses with all kinds of different species of birds, turtles. We've had homes with snakes. We've had the occasional random stray pig come in. Um,
Okay.
we had a sheep. Those are probably the craziest ones. We'll have like some, maybe like a coyote hybrid or something along those lines, or an injured coyote that might, somebody might cat on the side of
Okay.
the road. But thankfully, we haven't had any javelinas or mountain lions come in.
Right.
So
That. Okay. So if you go to medical school and you become a doctor for humans, right? Humans like are put together this way, right? As a vet, you just described like a turtle, a rabbit, like a bobcat, like those are different, very different. Like the pieces are in different places,
yes.
right? When you go to school for that, like, is there like a turtle section, or is it like I'm asking this question like really ignorantly, but you know what I'm getting at? Like,
Right.
how
Yeah.
do you
So
know what to do?
so oftentimes, so like the way that my school was formatted, because I went to a school that was a little bit different than your traditional school, but we would learn the basic. So the dog is kind of like the launching point. So we learned everything like anatomy wise about the dog. And then,
Hmm.
the cat anatomy is going to be similar, so you have your species that are similar. And then we would learn some stuff about, what the herbivores might be like, or so like your livestock, and then
Okay.
birds. And so you kind of lump them together to get the gist of the different types of, so like reptiles and that, and kind of just lump them. And then each one's going to have its little specialty, right? And so we don't have to learn about every single animal that's out there. You get the general concepts, and then as you go, you kind
Yeah.
of refine those. But yeah, so it is, no offense to your dad. When we were in vet school, we have the shirt that says real doctors treat more than one species. Um,
Totally. I've literally never thought about it until this conversation that you are responsible for whatever comes to the door that is alive and not a human, right?
yes, yes,
So, and the eyes are like everyone's looking at you and being like, hey, how do we fix this, right?
yep,
And then like that's a really big responsibility, and also probably sort of a fun challenge, I would imagine,
yes,
to
it can be.
to do that.
Yes, yes. Um,
And be like, I like saved a turtle, or I saved a whatever.
yeah, those, and of course those are the ones that people are really interested in, right? Because you could do the most amazing surgery on a dog, but if you pulled the fish hook out of a turtle's mouth or its throat, they're like, "Oh my gosh, you did what?" It's just because it's something different. You know what I mean? So, we
Yeah,
get a little,
of course.
yeah,
But I
yep,
think, yeah, I think everybody's sort of like familiar with this incredible amount of medicine that is available for their house pet, you know? But when you get into like this sort of more exotic animals, like people don't know much about turtles, you know? So
right.
to have spent some time with one, and maybe even got to know their like the way that they're acting a little, it is fascinating to people, particularly like to someone like me who doesn't really know anything about veterinary practice. All right, so okay, just to sort of finish up, what we talked a little bit about your sort of COVID keepers. Now that we're sort of in April of 2021, and sort of hopefully moving out of the pandemic and back into normal life. Um, we talked about remote work. We talked about, I imagine you're not doing the ABC teams anymore.
That is correct. We stopped that after the summer. It was
Okay,
actually very difficult for us, and um, the risk was we abated really a lot of people getting sick. So we were really, really
sure.
lucky. But yeah, so we
Yeah,
we needed
very.
all hands on deck because it's tough when the animals are coming in, and it was proving to be too difficult to have the teams that thinned out.
Sure, sure. And so what do you see moving forward in terms of other things that you might keep, or did we sort of cover them all?
Well, so right now so some of the things with our safety with our teams, we've really been pushing vaccination for our teams. Again,
Yeah.
we're in such small confined space that we just thought it's really important for everybody to be as safe as possible, and so we've been pushing the teams to do that. One of the bypass, if you're fully vaccinated, you get to bypass the temperature health screen. So that was kind of
Ah, okay.
a bane of everybody's existence, having to go around the building to that one entry to get screened before they could get to their stations. So that's been
Sure.
a carrot, I guess, to try to get people to be vaccinated. And also, we gave an extra day of PTO for folks who did get vaccinated. So that was one of the things to try to get us more back to normal. So if we have our staff is healthy, then that's going to allow us to do our regular stuff.
Sure.
We will do some hybrid stuff. We have for our vet clinics, it was really difficult to maintain the curbside appointments. It's just not something that I don't think there might be a few clients that like it, but in general, like the pets, it's stressful for the pets, leaving the owners behind in the car, coming into the clinic.
Right.
It's hard to have those conversations with the owners, about the treatment plans for the pets and things like that. So
Through the
we've kind
window. Right.
yeah, it's just less than ideal. Like you're trying to make important decisions and you're like on a
Hmm.
phone or and so it's just
Yeah.
those are better served in face-to-face conversations. But like our admissions appointments, we may be able to do some curbside, some have to come in. Our foster pickups, we're going to continue to do curbside. Our foster heroes really liked it. It was much more efficient, kind of like your school teacher stated. It's much easier to just
Right.
give them information on the phone. Here, we're going to bring the pet out to you, have a good day, versus coming in, sitting down for a half hour, yada yada. Our medical appointments our foster medical appointments in the shelter will be back face to face. So it's kind of a combination of
Hmm.
both. I see us as we're going to continue doing for now the adoptions by appointment. That's been very, very successful. So I don't see us stopping that in the near future. So those are some of the things that we're going to continue to do. Um, and just also, I think being flexible. I think this has taught us that it's okay to think outside the box. And maybe,
Hmm.
in 6 months, if we come up with a really what seems bizarre idea, but hey, maybe we should try it because it might actually really work. So I think just remembering to be flexible.
Sure. Yeah, like that sort of like I they call it A/B testing, right?
Hmm.
You do it the A way, but let's try the B way for like a week, and
Right.
see what it does. As long as you can sort of like, if it's an internal process, it's not difficult to message that out to the folks that work for you, right? If it's a front-facing public thing, you have to like put it on the site and tell people we're going to be
Right.
doing this thing, for
Yeah.
so that's a little bit more difficult, but still worthwhile if it makes a big difference. Like the example you gave earlier about the appointment, sort of viewings or get to know you period, I think was like just brilliant. And the fact that it resulted in maybe animals that were there for longer suddenly being adopted because they were really able to show themselves
Hmm.
on a more like one-to-one level. That's
Yeah.
just like brilliant. Awesome. Well, hey, I don't want to take up any more of your time. I really appreciate you joining us on this podcast. This has been a great conversation.
Oh, thank you for having me, and just thanks for putting these together. I think it's really interesting what how we've all adapted. Right, humans are amazing. What we
Yeah,
can do when kind of pressed against a wall, and what we can come up with. So this is great to hear everybody's viewpoint on the past year.
absolutely. Thanks again for joining me.